Respiratory therapists are a vital component of the healthcare ecosystem. They are going to work with patients from the very first breath throughout the lifespan to essentially the very last breath.
Respiratory therapists are at the most critical points of care in the hospital setting. With your sickest patients, there's really only 3 people in the room, and that's going to be a doctor, a nurse, and a respiratory therapist to care for the most critical patients that are out there.
When I was at hospitals, I would see the respiratory therapist. If there's an emergency, there's a code. They're in there doing all the things. And I felt like, well, I think that's something I want to do. And I called here, got more information, and I was like, yeah, sign me up. This is what I want to do.
The respiratory therapy program at South College is currently at 8 of our locations with additional to come. We're meeting the need in multiple communities, and being part of that big picture is very, very important. Our students start out with fundamentals of respiratory therapy. We do a stair-step approach where they learn in the classroom, learn in the lab setting, and then they are able to go out clinically and learn with our patients.
Some of the labs that the students will complete for respiratory therapy are things that involve intubation and airway placement, mechanical ventilation. We also work in neonatal and pediatrics, so they will work with infants. And then we also do specialty procedures such as pulmonary function testing and bronchoscopy.
We're going to work on intubation today.
Labs are very, very important. No one just wants to get thrown into a field and not have had any experience at all.
It's basically like real life. You can hear audible wheezes, you can hear anything from the simulator.
Breathe in and out like you normally would.
That allows us to identify what we need to be doing in this situation as well, like what's the next best step in this moment.
Next, what would you evaluate now that you started this patient on 1 liter per minute?
It's not something that I was necessarily confident with, but after working more towards it, you kind of have to get in your own head a little bit and be like, you can't be scared.
It does help build confidence.
That was a perfect example of how you draw blood gas.
It helps them to acclimate and perform at their highest level when their career starts.
Here at South College, we hire excellent faculty that bring field experience to our campus. Not only are they bringing the experience from the field, but then they're also going through professional development and learning how to translate that expertise in the field to the classroom.
They have a lot of experience and stories to help back up what they're teaching. Sometimes you need a little more than textbook. I need like a real life scenario.
As a program director and a professor, I try to build a great relationship with my students, getting them to buy into, you're going to be my colleague one day. I love seeing my students come to work or seeing them out in the field. Everyone's here for the same goal, and that is to become the best respiratory therapist they can be.
Respiratory has proven itself to be more than just breathing treatments. You're in just about every emergency situation, and you need to know how to handle those. And if you feel like that's a role for you, go for it.
There's an entire gamut of what, a respiratory therapist can do within the healthcare setting. We are at the bedside to help those patients breathe a little bit easier.